Brian, turmeric and curcumin is being sold around joint pain, inflammation, digestion, and absorption claims. What is the practical question people should ask before buying it?
The useful answer is not whether turmeric and curcumin is good or bad. It is whether your goal matches the evidence, whether your dose makes sense, and whether your safety context changes the risk. Curcumin interacts with inflammatory signaling in lab and clinical research. Bioavailability is low unless formulations or piperine-style boosters change absorption. Food spice, extract capsule, and boosted formula are different exposures. Joint discomfort is the most practical benefit people search. Inflammation claims need condition-specific outcome evidence. Digestive and liver claims are not the same as proven treatment.
So the danger is not that turmeric and curcumin is useless. The danger is that people hear one real pathway and turn it into a cure-all.
That is why the body ladder method starts with the target. What marker, symptom, deficiency risk, training goal, or timing problem are you trying to improve? Then look at dose, form, and product quality. The study product, the store product, and the influencer product may not be the same exposure.
What is the safety line for turmeric and curcumin? This is the part people skip when the benefit story sounds exciting.
Blood thinners, gallbladder disease, surgery planning, pregnancy, and liver concerns deserve caution. Piperine can change medication exposure. High-dose extract is not the same as turmeric in food. The practical ladder for turmeric and curcumin is: name the benefit, check whether the evidence matches you, choose a tested product, avoid unsafe combinations, and track the outcome that made you consider it.
So the fair summary is, turmeric and curcumin may be useful when the use case is specific, but the full answer lives in dose, form, person, and evidence tier.
Exactly. Curcumin has interesting anti-inflammatory mechanisms and some joint pain research, but absorption boosters and high-dose extracts can also change interaction risk. Use it as a decision, not a reflex, and keep the safety boundary in the same frame as the benefit.